Well, it's time to check in with infectious disease specialist Dr. Zain Chagla. Good morning. Thanks for joining us on this Friday. So since we last spoke, the federal government announced the plan on dropping pre-arrival COVID-19 testing at airports and land border crossings. You and I have talked about this forever, and you have long maintained it just didn't make any sense. It wasn't following the science, so obviously you have to be happy with that. What's the best practices going forward in staying on top of this?
Yeah, look, I mean, some testing at the airport for people returning, probably doing it more anonymously rather than tying it to quarantine is still helpful. Making sure that networks that can sequence people in their own communities, like our own, are still helpful for monitoring variants. But, again, that the travelers can feel the confidence of getting out of the country without having to go through a maze of tests to get back to Canada, is a positive point. And I really, really hope that this is the last time we invoke the border as part of our pandemic control so that people can actually book flights, get out of Canada, and again, not have to face something happening in the world that changes everything basically overnight.
Yeah, for sure. Everyone's kind of done with that, but of course we're still living with this thing and we're trying to transition to endemic. But having said that, we're getting major spikes around the world with the stealth Omicron variant popping up in many countries. How much concern is there for a spring wave in Canada?
Yeah, it's interesting. Different countries are really seeing different things. So places like in Asia, for example, in China and Hong Kong and South Korea, we're seeing a huge spike, but they really didn't have a first Omicron wave. So this is really it that's showing up. What we went through in January and February. The numbers are higher, but really is that unbridled growth that we saw back then. And we are seeing through Europe, growth in different settings. I think, we do know we probably have reached the lowest in terms of case numbers in the community from what's happened over the last few months with BA1. But I think, again, the vaccines still seem to work well against this stealth Omicron variant. People who've had COVID seem to still be protected against this stealth variant, particularly Omicron. And so, I think we're going to see some rise in transmission. The good thing is that we are seeing places like the UK, Denmark, seeing record lows in terms of what's been in the intensive care unit. And so that really may be that immunity holding up to at least prevent people from coming into hospital in droves like we saw back in January and February.
Yeah, now, this is generalizing a bit, but is it fair to say that these variants tend to be more virulent but weaker as we see more?
Yeah, look, there is the virus itself that's changing, and it continues to change. There are new, combinations of Omicron that have shown up even this week. But the major point here is that there is just such a layer of immunity in the population. We are very different than 2020. And again, we are seeing what's happening in Hong Kong and in China in a population that was never really exposed to COVID-19. They're seeing unbridled growth. And that really is what these variants can do in a population that's well immunized, and some of it got COVID as well. It's going to be a very different story, particularly as it relates to hospitalizations and deaths.
Yeah, but certainly in the developed world, pretty good shape with immunization. But since you and I last spoke, there was a study that showed that a fourth dose of Pfizer or Moderna isn't offering that much more protection. What's your thoughts on booster shots going forward?
Yeah, look, I think the most vulnerable populations in our society still need to be looked at for this. So those over the age of 65, those with major immunosuppressive issues, those looking in long-term care, they've suffered the brunt of this pandemic. And again, if there is any way to give them extra protection, then so be it. But I do think, there probably is a limit, or at least probably a limit to these vaccines amongst younger individuals who, with 3 doses of vaccines, puts them at incredibly low risk of hospitalization. And so, yeah, I mean, I think our strategy moving forward with mRNA vaccines is to make sure the most vulnerable are topped up as much as possible. And again, looking forward to our next generation of vaccines, which may offer a lot more towards reducing transmission in our community as compared to the current series of vaccines.
Yeah. Oh, we have like 30 seconds left, but I want to get your comment on a story we had this morning. Moderna approved in Canada for 6 to 11 now, also approved in Australia and the EU. But in the U.S., Moderna is still waiting for approval for 12 to 17. I thought it struck me that Canada approved it before the U.S.
Yeah, I mean, these pathways are different. They go through different reviews. They have different priorities. It's good to have more tools. And again, I think it'll probably reach the U.S. at some point in the next few weeks.
Okay. Hey, that's our time, but we'll chat again next week. Have a great weekend. Infectious disease specialist, Dr. Zain Chagla.